When most people think about retirement, they picture travel, time with family, and finally being able to do what they want with their days. But there's one part of retirement that doesn't make it into those glossy brochures, and that's healthcare. Here's the reality. For many retirees, healthcare ends up being the second or third biggest expense in retirement, right behind housing, food, and taxes. Fidelity estimates a 65-year-old couple today may spend over $300,000 on healthcare over the course of their retirement. And that's not even including long-term care. And yet, when I sit down with families, this is one of the most overlooked parts of their retirement plan. People assume Medicare will cover everything, or they underestimate how much costs will rise as we age. So today, I want to walk you through how retirement healthcare planning really fits into your plan. Before Medicare, once you hit Medicare, and then later on in retirement. My goal is to help you see healthcare not as a separate problem, but as part of the bigger financial picture. Let's start why this matters. Healthcare costs have historically risen faster than inflation. If groceries and gas feel expensive, healthcare is often increasing at an even higher pace. Premiums, co-pays, prescriptions, dental, vision, hearing, it adds up incredibly quickly. And if you don't plan ahead, these expenses can sneak up on you and blow a hole through your retirement budget. But here's the good news. With the right planning, healthcare costs don't have to derail your retirement. They just have to be built into the plan, right into the chassis, the same way you account for income, taxes, and investments. And that's what we're going to walk through today. Now, one of the biggest challenges I see is what I refer to as the pre-Medicare gap. A lot of people, they dream of retiring at 60, 61, 62, but Medicare doesn't start until the age of 65. That means there's a gap of sometimes 5 years or even more where you've got to figure out how are you going to address health insurance in your plan. So what are your options? Well, you have COBRA. If you're leaving your employer, you might be able to keep your old health plan for up to 18 months. Now, there's a downside. It's expensive because you're paying the full premium plus generally a small administrative fee. Then you have the ACA Marketplace. That's otherwise known as Obamacare. And this can be a really great option, especially if your income is lower in those early retirement years, because in fact, subsidies can be significant if we structure your withdrawals carefully. However, we don't know what subsidies will likely look like in the future, but you have to be careful here. If your income is too high, you could accidentally disqualify yourself for some of those subsidies. Another option is private insurance. Sometimes it's the only option, but it's usually the most expensive. This bridge period is critical. The decisions you make here about when to retire, where to get coverage, and how much income you need, it will ripple into the rest of your retirement. Now, there are some other options out there, like healthcare ministries or Christian-based group insurance plans, but understand those aren't traditional insurance plans, and there are rules and restrictions. So make sure before you make that decision, you understand explicitly what your coverage options are. Now let's talk about what happens once you reach 65 and Medicare kicks in. Look, Medicare is a fantastic program, but it's not free and it's oftentimes not simple. So here's a basic breakdown. Part A, it covers your hospital care and usually has no premium. Part B, it covers doctor visits and outpatient care, but it does come with a monthly premium, which can increase based upon your income. Now, Part D, that's your prescription drug plan, and the premiums can vary, and the government's made a lot of changes here, but understand that each plan potentially has a different cost. Then you have a choice, and this is where some of the confusion really lies. You can go with original Medicare plus a Medigap supplement, or you can choose Medicare Advantage plan, and that's Part C. Now, both paths, they have their pros and they have their cons. Supplements, they may give you more freedom and fewer out-of-pocket surprises, but they're generally going to cost more each month. Advantage plans, they can be cheaper up front, but they may have significant restrictions. The key point here, Medicare is not a one-size-fits-all approach. The right choice, it depends on your health, your doctors, where you live, your prescriptions, and your budgets. And it's important here to make a right and smart decision. Even with Medicare, you're still going to face ongoing costs. Premiums, deductibles, co-pays, dental, vision, none of that goes away. And don't forget about inflation. Healthcare costs have historically risen faster than the overall economy. So the $500 a month you pay today, that might actually be $700 or $800 just a few years from now. Now, this is why healthcare can't be an afterthought. It has to be baked right into your financial and your income plan, right along with housing, groceries, travel, gifts, everything. Hey, by the way, if you're finding this video helpful, go ahead and hit the like button and the subscribe button to the channel. We post new videos every week on retirement planning. In this way, you won't miss out on the strategies that can make a real difference in your retirement. Now let's talk about the 800-pound gorilla in the room, the big wild card, long-term care. This is not an easy one. This is the part of the healthcare system that scares so many people, and for good reason. Medicare doesn't cover custodial care, like assisted living or a nursing home, if you simply can't care for yourself or your spouse can't care for you at home any longer. So how do you plan for it? Well, you have traditional long-term care insurance, and that covers your daily or monthly benefit if you need care. But there's a downside. Premiums can be extremely high, and if you never use it, the money's gone. It can also be very restrictive around the care, and it can be very restrictive around what it provides over time. Then there's the hybrid policies, and these either combine life insurance or annuities with long-term care benefits. And if you need care, the policy pays, and if you don't, the heirs get the death benefit. You can also consider self-funding, and some people will set aside a part of their portfolio specifically for future care needs. So it's important to recognize there's no perfect solution here. There's no perfect answer, but ignoring long-term care, I think it's one of the worst options you can choose. If one spouse ends up needing care in a nursing home, the cost can escalate really quickly. It can drain your assets and leave the other spouse in a very difficult situation. So part of retirement planning is simply asking, if this happened, what is our plan? What do we do if somebody ends up in the nursing home? Here's the big picture. Healthcare isn't separate from retirement planning. It's woven into your financial plan like everything else. So think about it. Your income strategy affects your healthcare premiums. Take too much from your IRA and you might end up pushing your Medicare premiums higher through IRMA surcharges. Tax planning, it could affect your ACA subsidies before 65 if you did something like a Roth conversion. Your investment strategy could affect how you'll fund your healthcare and whether you can keep up with the rising costs. And your estate plan, well, you may need to account for healthcare and long-term care expenses so your spouse or your kids are not left in a bind. This is why we don't treat healthcare as some side note, some special thing that we just do once. It's one of the pillars of a solid financial plan, right up there with income, taxes, investments, and legacy planning. So let's recap. Healthcare is likely one of the largest expenses you'll face in retirement. It starts with bridging the pre-Medicare years if you retire early. It continues with Medicare at 65, where the choices, they really matter. And it extends into long-term care, which could be one of the biggest financial risks you face. The point isn't to scare you. It's to help you see that healthcare planning isn't separate from retirement planning. It's an essential part of it, in my opinion. But here's the good news. You don't have to have all the answers today. What you do need to have is a plan, a way to fit healthcare costs into your bigger retirement picture so you can enjoy the freedom you work for without fear of unexpected expenses along the way. That's exactly what we do to help families every day at Martin Wealth. If you're starting to think seriously about retirement, make sure healthcare is part of the conversation. If you want to learn more about how we may be able to help you, go out to martinwealth.com. Hey, thanks so much for watching. I'm Jim Martin, and I'll see you on the next video. Take care.